There are conversations I've had with patients that I've never forgotten, not because we discovered cancer, but because we discovered a medical test they never truly needed. I remember a man named Walter, 74 years old, sharp as a tack, still mowing his own lawn every Saturday. He came into my office one afternoon holding a folder full of test results from a private screening company he'd seen advertised on television. Full body scan, blood panels, hormone levels, the works. He'd paid nearly $2,000 out of pocket, and he sat across from me, visibly shaken, pointing at a line on page 3 that said, "Indeterminate nodule, recommend follow-up imaging." Walter hadn't slept in 4 nights. He told me he'd already started thinking about who would take care of his wife if this turned out to be something serious. We spent the next 45 minutes together, and by the end of that conversation, after I explained what that finding actually meant statistically, at his age, with no symptoms, no family history pointing that direction, Walter breathed out a sigh I still think about. It wasn't cancer. It was something so common in men his age that radiologists have a name for it. An incidental finding. A discovery nobody was looking for that, in his case, changed nothing about his care except giving him 4 sleepless nights and a knot in his stomach that didn't need to be there. I've had versions of that conversation more times than I can count over the past 35 years, and it's part of why I wanted to sit down with you today. My name is Dr. Alan Mercer, and for more than 3 decades I've had the privilege of caring for older adults, watching them go through health scares both real and imagined, and helping them make sense of a medical system that, frankly, can feel overwhelming even to those of us who've spent our whole careers inside it. Before we go any further, I want to be very clear about something, because this matters to me. This isn't a video telling you to avoid doctors, and it isn't a video telling you to skip medical care. Quite the opposite. Regular checkups, screenings, and an ongoing relationship with your physician are some of the most valuable things you can do for your health as you get older. What this video is about is something a little more nuanced. It's about understanding that not every medical test is right for every person, at every age, in every situation. Medicine isn't one size fits all, even though a lot of the advertising you see makes it feel that way. My hope today is simple. I want to walk you through 5 medical tests that I personally approach with real caution when I'm sitting across from a patient over 60. Not because these tests are bad, not because they don't have their place, but because in certain situations, for certain people, they can do more to create anxiety and confusion than they do to protect your health. And by the end of this video, my goal isn't for you to walk away avoiding your doctor. It's for you to walk into your next appointment with better questions so you and your physician can make the right decision together for your body, your history, and your life. Let's start with the first one, because it's become almost impossible to avoid seeing advertised these days. The routine whole-body CT scan. You've probably seen the commercials. Sleek clinics, reassuring voiceovers, promises of peace of mind, and catching problems before they start. For a fee, sometimes a few $100s, sometimes well over $1,000, you can walk in and get your entire body scanned from head to pelvis, no doctor's referral required. I understand the appeal completely. The idea that we could look inside the body and catch a hidden danger before it causes any symptoms feels like exactly the kind of thing modern medicine should be able to do. And in certain specific situations, imaging like this absolutely does save lives. If you have a family history that points toward a particular risk, if you have symptoms that need investigating, if your physician has a specific concern based on your history, then targeted imaging can be enormously valuable. The trouble is, what happens when we scan a body that has no symptoms and no elevated risk, just to see what's there? The human body, especially as we get into our 60s, 70s, and beyond, tends to accumulate small, ordinary imperfections. Little cysts on the kidneys, small nodules on the thyroid or the lungs, tiny variations in blood vessels. Most of these are what we call clinically insignificant. They were never going to cause a problem in your lifetime. But once they show up on a scan, they can't be unseen. And that finding often triggers a cascade. More imaging, sometimes biopsies, weeks of uncertainty, and for many patients, real emotional distress, even when the eventual answer is reassuring. There's a term in medicine for this. We call it overdiagnosis. It doesn't mean a mistake was made. It means we found something true that was never going to hurt you, and in the process of investigating it, we sometimes caused harm we wouldn't have caused otherwise, whether that's the anxiety Walter experienced, the cost of follow-up procedures, or, in rarer cases, complications from an unnecessary biopsy. So, if you're considering a whole-body scan, my advice isn't to avoid it outright. My advice is to ask yourself why. Are you having symptoms? Is there a specific concern? Or are you simply hoping a scan will catch something before it becomes serious? If it's the latter, I'd encourage you to have that conversation with your own physician first, because they can help determine whether targeted screening, based on your actual risk factors, might serve you better than a broad search with no clear purpose behind it. But that's just the first one. And honestly, the second checkup surprises a lot of my male patients, because for decades, it was considered standard practice for almost every man over 50. I'm talking about routine PSA screening for prostate cancer. For years, the guidance was simple. Once you hit a certain age, you got your PSA checked annually, no questions asked. And I want to say clearly, prostate cancer is real, and for some men, PSA testing has been genuinely life-saving. This isn't a test I dismiss. It's a test I think about very carefully, especially for men in their 70s and beyond. Here's the complexity. PSA, or prostate-specific antigen, is a protein that can rise for many reasons that have nothing to do with cancer. An enlarged prostate, which is extremely common as men age. An infection, even something as simple as recent physical activity. So when a PSA level comes back elevated, it doesn't tell us there's cancer. It tells us we need to look further, and that further look often means a biopsy. Now here's what's important to understand about prostate cancer specifically. There's a wide spectrum. Some prostate cancers are aggressive and genuinely dangerous. But a great many prostate cancers, particularly in older men, grow so slowly that a man is statistically more likely to live the rest of his natural life without that cancer ever causing symptoms or becoming life-threatening. This is one of the most well-documented phenomena in cancer screening, and it creates a real dilemma because once a biopsy detects prostate cancer, it's very difficult, both medically and emotionally, to simply do nothing. Many men choose treatment, and treatment, whether surgery or radiation, carries real risks. Incontinence, erectile dysfunction, a recovery process that can be difficult, especially for a man in his late 70s or 80s. I had a patient, I'll call him Frank, 81 years old, otherwise in excellent health, who came to me after a PSA test through a general wellness screening flagged a slight elevation. He was terrified. We talked at length about his overall health, his life expectancy, his personal values, and ultimately, together, we decided that watchful monitoring made more sense for him than an aggressive workup. 2 years later, Frank is still playing golf twice a week, and that PSA reading never turned into anything that changed his quality of life, because we approached it thoughtfully rather than reflexively. This is exactly why major medical organizations now recommend that PSA testing, particularly for men over 70 or men with limited life expectancy, be a shared decision between doctor and patient rather than an automatic annual test. If you're a man watching this and you've never had this conversation with your doctor about the pros and cons of PSA screening specific to your age and health, I genuinely encourage you to bring it up at your next visit. Now, the third checkup on my list surprises nearly every patient I talk to because it feels like something we should absolutely be doing every single year, without fail. I'm talking about annual stress tests in patients who have no cardiac symptoms whatsoever. Heart disease is, without question, one of the most serious health concerns we face as we age, and I take it extremely seriously in my own practice. If you're experiencing chest pain, shortness of breath, unusual fatigue, or other symptoms that could point toward your heart, please don't wait and don't let anything in this video make you hesitate to seek that care immediately. That's not what we're discussing here. What we're discussing is the practice of getting a cardiac stress test every single year, as a matter of routine, in someone who feels completely well, has no chest pain, no shortness of breath, and no new symptoms at all. This became something of a habit in certain wellness screening programs, this idea that testing the heart annually, the way we might get an annual physical, would catch problems early. The evidence, though, tells a more complicated story. In people without symptoms, routine stress testing has a meaningful rate of false positives, meaning the test suggests a problem that further investigation, sometimes including invasive procedures like a cardiac catheterization, ultimately shows wasn't there. And cardiac catheterization, while generally very safe in skilled hands, does carry small but real risks, including bleeding, and in rare cases, more serious complications. I think of a patient, Dorothy, 76, who had been getting an annual stress test for years as part of a wellness package her daughter had signed her up for. One year, the results came back ambiguous, not clearly normal, not clearly abnormal. That single ambiguous result led to a cardiac catheterization, which ultimately showed a completely healthy set of coronary arteries. Dorothy handled it well. She's a resilient woman, but she told me afterward that the 2 weeks of waiting for that procedure were some of the most anxious weeks of her life, worrying she might have a serious heart condition when in the end she simply didn't. This doesn't mean stress testing isn't valuable. It absolutely is, for the right patient. If you have symptoms, if you have significant risk factors your doctor is concerned about, if you're preparing for a major surgery, and your care team wants to assess your cardiac risk beforehand, a stress test can provide crucial information. What I gently caution against is the idea that testing your heart every single year, in the complete absence of symptoms, is automatically the safest path. Sometimes the safest path is simply knowing your blood pressure, your cholesterol, staying active, and having an honest conversation with your doctor about your personal risk, rather than defaulting to invasive testing on a fixed yearly schedule. The fourth checkup on my list is one that catches a lot of my patients by surprise, because it involves a part of the body most people never think to worry about until someone mentions it. I'm talking about carotid ultrasound screening in adults who are otherwise at low risk for stroke. The carotid arteries run along either side of your neck, carrying blood to your brain. As we age, these arteries, like others in the body, can develop some narrowing from plaque buildup. And because stroke is such a frightening and serious condition, it makes intuitive sense that checking these arteries with a simple, painless ultrasound would be something we'd want to do for everyone. But here's where the evidence has led major medical guideline groups to actually recommend against routine carotid ultrasound screening for people without symptoms and without significant risk factors. The reasoning comes down to something we touched on earlier, the difference between finding something and that something actually needing to be acted upon. Mild to moderate narrowing in the carotid arteries is common as we age, and for most people with no symptoms, no history of mini strokes, and well-managed blood pressure and cholesterol, that narrowing isn't going to lead to a stroke and doesn't require surgical intervention. Yet once it's found, it can be very hard for a patient not to want to do something about it, and in some cases, that something is a surgical procedure that carries its own risks, including, ironically, a small risk of stroke from the procedure itself. I remember a patient, George, 68, incredibly health conscious, who signed up for a mobile health screening event at his local community center that offered carotid ultrasounds along with several other tests. His results showed mild narrowing, well within the range we'd expect to see in a man his age with no symptoms. But the report he received didn't explain that context well, and George arrived at my office convinced he was on the verge of a stroke. We spent time going through what the finding actually meant, reviewed his blood pressure and cholesterol management, which were both excellent, and I was able to reassure him that no procedure, no additional intervention was needed. Just continued attention to the risk factors he was already managing so well. If you do have symptoms like sudden vision changes, weakness on one side of the body, or slurred speech, that's an emergency, and you should seek care immediately. That's not something to wait on. But for routine screening in someone without symptoms and without significant risk factors like a strong family history or previous mini-strokes, this is a conversation worth having with your doctor about whether it's truly warranted for you. Now for the final one, and I'll tell you honestly, this might be the most misunderstood test of them all because it doesn't come from a hospital or a doctor's referral most of the time. It comes from advertisements, from supplement companies, and from wellness clinics eager to sell you something afterward. I'm talking about extensive vitamin and hormone testing done without a specific medical reason behind it. I want to be careful here because there are absolutely situations where checking vitamin levels or hormone levels is exactly the right thing to do. If you're experiencing fatigue, unexplained weight changes, or other symptoms that could point to a thyroid issue, a vitamin D deficiency, or a hormone imbalance, testing makes complete sense. And I order these tests regularly for patients with real symptoms. What concerns me is the growing trend of extensive panels, testosterone, estrogen, a dozen different vitamins, sometimes marketed directly to seniors, done in the absence of any symptoms at all, simply because a lower number on paper is assumed to mean something needs fixing. The truth is, many of these markers fluctuate naturally, and what's considered a low normal range for a 75-year-old isn't necessarily something requiring correction. Yet these panels often come bundled with a supplement or hormone therapy recommendation attached, sometimes from providers who have a financial relationship with the products they're prescribing. I had a patient, Helen, 79, who came to me after a clinic recommended she start hormone replacement therapy based on a blood panel she'd gotten through a mail-order testing kit. She had no symptoms whatsoever. She felt wonderful, still gardening, still walking 2 miles most mornings. When we reviewed her results together, nothing in her actual health picture suggested she needed hormone therapy, which, particularly in older adults, can carry real risks depending on the individual's health history. We talked it through, and she decided to hold off, continuing the healthy lifestyle that had clearly been serving her well for years. My advice here is simple. If you're not experiencing symptoms, be thoughtful before pursuing extensive testing purely because it's being marketed to you. And if a result does come back low, ask what that number actually means for someone your age, and whether treatment is genuinely necessary or whether it falls within a normal range of variation. That conversation belongs with your own physician, someone who knows your full history, not a testing kit that arrived in the mail. So those are the 5. Whole body CT scans done without a clear reason. PSA screening without a thoughtful conversation about your individual situation. Annual stress tests in people without symptoms. Carotid ultrasounds in low-risk adults. And extensive vitamin and hormone panels pursued without symptoms driving the search. If there's one thread running through everything I've shared with you today, it's this. More testing doesn't always mean better care. Sometimes it does. And when it's the right test, at the right time, for the right reason, it can be one of the most valuable things modern medicine offers us. But every test carries the possibility of an unclear result, and every unclear result carries the possibility of worry, additional procedures, and sometimes real physical risk on top of whatever we were originally trying to prevent. None of this means you should skip your checkups or feel hesitant about screening. What it means is that you deserve to be an active participant in that decision. You deserve to ask your doctor, why is this test being recommended for me specifically? What would we do differently based on the result? And is this the right choice given my personal health, my history, and my own values? Those questions don't make you a difficult patient. In my experience, they make you exactly the kind of patient every good physician wants to work with. Someone who's engaged, informed, and genuinely invested in their own care. If today's discussion was helpful, I encourage you to explore the other videos here on this channel. I've created them to help adults over 60 better understand their health, recognize important warning signs, and make informed decisions alongside their healthcare providers. Thank you for spending this time with me. I'm Dr. Alan Mercer. Take good care of yourself, and I'll see you in the next video.